morning I wanted to show you a minimally invasive procedure we did to correct a significant Haglund's deformity with a very small posterior heel spur as well. And we did this minimally invasive. The patient is only 3 weeks out and no longer having pain. Let me ask you something. Before we did the surgery on the back of your heel, from 0 to 10, 10 being bad pain, 0 being no pain, what was your scale rate?
10.
So you were to 10. Everybody likes to say 10. Anyway, so at 10, and what we did, we numbed her in the office and performed a minimally invasive procedure. The way we did this, if you look real close, we did an incision here and a counter incision on the lateral side of her foot, and this allowed access to create a portal so we could get our 3-1 burr here and remove the exostosis. What I also did, she had a small posterior calcaneal spur here as well, so she has some spurring actually in the actual tendon. What we did with that, we went lateral and denuded that from the insertion and kept our insertions on the outside intact. We're able to take the middle spur out as well. To add to our deformity, we also did a percutaneous Achilles tendon length. We can see the incision here and here, and this is the percutaneous slide tendon lengthened. So the normal recovery of this is fairly lengthy if you do this open. This has only been 3 weeks later, and we did put her in a regular cast for 2 weeks. She's now back in a cam walker. So start off with a traditional cast, and we'll show you the x-ray of that. But already back in just 3 weeks, a real quick recovery, no longer in any pain now. What's your pain level now?
0.
So she's at 0, even just in 3 weeks. So minimally invasive surgery can be performed for posterior heel spurs as well. It's not good for a large posterior heel spur. You're going to have to open that. But for a Haglund's deformity with a very small posterior calcaneal spur, you can take care of those as well with minimally invasive surgery. And you can do all the Haglund's deformities like that. I like to throw in the Achilles tendon lengthening because most of these deformities are also caused by biomechanical issues. And if you reduce that equinus deformity, the pain goes away as well. If you just address the equinus, a lot of the patient's pains, it will go away in a lot of the patients, but some of these fairly large Haglund's deformities, they have to be removed as well. So I don't like to just do the gastroc or the Achilles in a patient that has a fairly significant or large Achilles posterior spur or a large Haglund's deformity. One way I look at that, I take the ultrasound and watch the tendon move. If there's a large burst in there, then we take that out in our process of taking the Haglund's off. So anyway, this is a typical result we're getting with this doing a minimally invasive.